Hey everyone, it's Dr. Jen here. Hello, welcome to What's Up Wednesday. Sorry I missed you last week. I was away and I got a little sick myself coming back on the airplane. I have a little bit of a cough, but I feel okay, so I wanted to come today since we were not together last week. So anyone new who's joining me today, excuse my hoarse voice today, but I'm bringing you today What's Up Wednesday, tips on teeth, all about dental care, caring for your child's teeth, and also about teething as well too. I know a lot of parents ask me about teething and caring for the mouth, when they should go to the dentist. This is actually National Children's Dental Health Month, and so that's why today I want to speak to you about it. It's the last day of the month of February, and it's important to take care of your kids' teeth all year long. But today I just, especially because it's the awareness month for children's dental health, I wanted to speak about it a little bit more. Parents are often confused when they should see a pediatric dentist. Do they even need a pediatric dentist for their little ones? So welcome. We're going to speak all about that today on What's Up Wednesday. And for those new people joining me, hello, I'm Dr. Jen. I am a pediatrician, and I work as an assistant clinical professor of pediatrics at the Mount Sinai School of Medicine here in Manhattan. I'm in private practice at Carnegie Hill Pediatrics, and I take care of children from newborn through young adulthood and really spend a lot of time with parents, helping to allay their fears and anxiety, really giving them that expert advice and information so they can make informed decisions like you, being a parent, about taking care of your own child. Because when you have that information, you feel more confident and secure in the decisions that you make as a parent. So today, as I said, we're going to be talking about tips on teeth, all about caring for your child's teeth. And so it's really important. Parents often don't think about baby teeth as being important because they're not their permanent teeth, but they actually do have an important function. They're important for chewing and for talking, but as placeholders for when the permanent teeth come in. So it's really important for the baby teeth to be in there, so then the adult permanent teeth come in to the right spots as well too. So it's very, very important, and we're going to talk about caring for them today. So one thing that happens is dental caries or cavities. And yes, again, some people say to me, well, it doesn't really matter, they're baby teeth, they're going to fall out. But you don't want your child to have cavities for many reasons. So cavities are caused from bacteria that's in the mouth. These bacteria actually take sugars from different foods, and we'll talk about high sugar foods and what are common causes of sugar causing cavities in kids' mouths. But the sugar gets broken down into acids, and the acids erode the enamel on the teeth, and that causes cavities. And that can be painful for kids. It may not actually be painful till it's too late. They can get severe infections. I've seen kids that need root canals, teeth pulled out. So you just really, really want to be careful. In fact, also, you can get infections in your teeth that can actually then spread throughout the bloodstream and get an infection as well too. So it's very, very important, as you see that I keep saying, about caring for your child's teeth, even if they are baby teeth. So as I said, there are many things that cause dental caries, and one of them is all that sugar. So you have to be really careful when you're feeding your baby, especially when you're using bottles. So there's something called milk bottle caries, and that occurs really when you're leaving your child at night. If you prop up a bottle, that also gives too much sugar throughout, bathing their teeth in it. And if you give them a bottle and you leave it in their crib at night so they can take it when they want, again, not a good idea. Through the nipple, the sugar gets all over their teeth, and also juice. We've had a whole discussion here on What's Up Wednesday about juice and all the damage that it can do for many things, not just their teeth. But juice, yes, is very concentrated sugar and can cause dental caries. So I totally avoid juice for all costs in babies, especially infants, never in the bottle. And we'll talk more about when and if you're going to give it, what to do, and how to do it the safest way to prevent cavities. So it's really important to brush your child's teeth frequently, and we're going to talk about that. But first we're going to talk about the mouth care before the teeth even come in. So right from the start, parents often ask me, do I need to do anything to care for my baby's mouth? And the answer is yes. And sometimes they look at me surprised. What do you mean I'm supposed to clean my baby's mouth? But you are. If you don't, you'll probably notice a thick white film or a coating on the tongue. And this can be really thick and yucky and whitish, gray even. And if you take a washcloth or a wet gauze around your finger, you should clean the tongue, and you'll see that it will come right off. You want to clean around the gums and stuff too. Some people get confused about, they may think that the child has, or the baby has a fungal infection or candida or a yeast infection in the mouth. And that could be so, but often that's not just a coating on the tongue. It's like little red, you'll see little white spots on the gums, and when you try to wipe them off, it won't come off, as opposed to milk that sort of wipes right off. So clean the baby's mouth frequently. If you have concerns whether it is milk or it's a yeast infection, certainly it's important to bring your baby in to be seen by their pediatrician, and your pediatrician can tell you right away. If it's a yeast infection, they may need treatment. There's treatment drops that they can have, but also it's important then to find out where the source was from. If it was also on things like the baby's nipples, from the bottles or the pacifiers, you have to make sure that you sterilize them, clean them. Sometimes it may just be easier to get new ones. And then the same thing if you're breastfeeding or if you're using a breast pump, make sure that's sterilized and clean so that the infection, the yeast infection doesn't keep continuing to come back, or the thrush in the baby's mouth. So that's important too, even before their teeth come in. Now it is rare. Some babies are actually born with teeth. My nephew actually was born with 2 teeth, and they're perfectly fine. Sometimes it gets a little iffy with breastfeeding, but it's still okay to do. You just want to make sure that they're not loose, because then there could be a choking hazard. So if you ever notice teeth, or I'm sure your pediatrician right at birth would notice as well too, they'll have a discussion about if anything needs to be done. But normally it's usually fine, and nothing to worry about, though it's not that common. But excuse me, today I have a little bit of a hoarse voice and sore throat, but I'm going to keep on going today with What's Up Wednesday. So teeth, when do they first come in? So normally teeth usually come in around 6 months or so, 4 to 6 months, but I often have patients come in and say at like 3 to 4 months, I'm sure my baby's drooling a lot, they're putting their hands in their mouth, they definitely have teeth coming in. And so then I do my normal exam and I see, and I really show them, look, there's really no teeth coming in yet. And it's not uncommon for parents to think that. So drooling and getting a lot of saliva at 3 to 4 months is totally normal. It's developmentally normal. They just are producing more, and they just haven't really figured out physiologically to swallow it. The whole mechanism sucks swallows with them. They also pull a lot more saliva in their mouth. So it's not always a reason for teething, and more likely at 3 months it's not. Again, also developmentally, 3 to 4 months, they're able to now bring their hands to their mouth and put their fingers in their mouth, start chewing on things more. So mommies always think that their babies are teething at that point. But again, that's just developmentally normal and appropriate too. But as I said, so usually around 6 months or so, and again, it can be different. Usually the 2 teeth on the bottom come in, and then the 2 teeth on the top, and then the 2 teeth next to that on the top, and then the 2 teeth on the bottom. So then they have those 8 teeth in. And once those come in, and they sometimes come in like right away, or 2, then the other, and wait, it's so variable. I tell parents, like, don't freak out or worry. You know, some babies don't even get teeth until they're 1, and that's okay. They actually, you'd be surprised, I see it all the time, babies learn to eat quite a lot of food without their teeth yet, so don't get too nervous or panic. It's totally normal. But after those 8 front teeth come in, then usually they skip what we call the canines or the incisors and goes to the first molars on the top and the bottom. And then those canine teeth come in. And then somewhere between 2 and 3, the second molars come in. And so by 3, usually all 20 teeth are in. And again, we want to keep those teeth strong and healthy. So you need to start brushing right away. And that's the question, what do I need to do when my child only has 1 tooth? And yes, it's important to start brushing right away. You want to get a soft toothbrush. You can actually, there's ones that you could put like right on your fingertip, and you can brush the baby's teeth, or you could just buy a little baby toothbrush. And the recommendations now from the American Academy of Pediatrics, as well as the American Dental Association, is to use a very tiny smear of toothpaste. And actually, even though if it's baby toothpaste, it should have fluoride in it. And when I say a smear, I mean a really little bit, just like a grain of rice. That's a really tiny bit. So I don't know, I actually think it's much less than a smear, but a grain of rice is what they recommend. And so you put that on the toothbrush, and you want to make sure, as I said, it has fluoride in it. We want to use that very little amount because, yes, the babies are going to swallow it. They're not able to spit it out. Most kids can't really spit the toothpaste out properly until they're at least 3 years of age. So we want to use just a very little bit, and that coating does help to protect the teeth. And parents do ask me if it's necessary, and as I said, it really has been protective. And we hear so much, and then you hear in the media and that fluoride is good for you, or you hear fluoride is bad for you, but fluoride really has been proven to help with dental cavities. The issue is that you don't want too much, you don't want too little. Too much fluoride can be a problem. It can cause something called fluorosis. It can be little spots on your teeth that really aren't that appealing to look at. So yes, you don't want to have too much. So make sure that you do speak with your pediatrician and your pediatric dentist, that I'm going to talk about in a minute, about fluoride, because as I said, you want a little bit on the toothpaste, but you may need supplements, and that depends on what's in your water. There are many counties or districts that already have fluoride added to the water. There's actually some that have too much, so you may want to use bottled water and not your tap water. So again, it depends. You can usually ask your pediatrician in your area would know, or the dentist in your area, and if not, you can always have your water tested or call your local water company as well to find out. But the recommendations in general are a little smear or a grain of rice for those newborn young first teeth that are coming in. So then what happens, I said, at age 3. So at age 3, when your child's a bit older and they're able to handle the toothbrush and can spit out toothpaste, we go to a pea-size amount. And this is, again, by then they have all 20 of their teeth in. You really want to brush well. And really, 3-year-olds and toddlers should not be brushing the teeth themselves. To clarify, yes, they can brush their teeth themselves, but you still need to do it as well. And so that's why it's good to get into the habit of doing it right from the start. Again, building those healthy habits, because it'll just be part of their nighttime routine. I recommend at least twice a day, in the morning and at night before they go to bed. Morning, even after breakfast, is a good idea to help to clean off all the sugar from what they ate in the morning before them leaving to go to school or preschool or just, playing. So you want to make sure that they brush well. And what I mean by brushing well is brushing at least 2 minutes. And what's really important to teach kids to do, and you're going to do it yourself until they're older, I advise supervising until at least age 6 or so. But you want to make sure that they brush in circles. So, right, the first thing people always think is back and forth, but you want to do circles. And the most important part is near the gum line. That's where all the plaque and that's where the cavities and in between occurred. So you want to make sure you're doing that, not just the straight across for like a nice smile, but you want to do round and round circles and make sure you're getting the back of the teeth and all the different surfaces of their teeth. That's what's really the most important. So you want to make it sometimes as fun as possible, especially for those toddlers and those young kids who are trying to practice to learn to be able to do it themselves. I can give you a few tips. So for those young toddlers, to make it easier, you may have them hold a toothbrush while you're brushing their teeth, and then they can do it on their doll or their stuffed animal, or even if you want, you can have them do it on your teeth as well too afterwards. Different colored toothbrushes can be helpful for older kids, toddlers, and 3, 4, 5-year-olds. They may like to use an electric toothbrush, and that's totally fine too. They often play music as well, or they often have timers. You can even use like a little plastic timer that they can visualize and see, so they know when the 2 minutes is up after brushing their teeth. But you just want to get into this regimen and this habit of doing it, so then they'll just be like, one day, Mom, I have to brush my teeth before I go to bed. And you're like, oh yes. So you can't rush them because they know that it must be done. So again, just building those healthy habits and keeping those teeth clean is really important. So when should your child go to the dentist? So as soon as that first tooth comes in, that's a great time, or by age 1. It's a really good time to go to a pediatric dentist. Often in some areas, we're here in New York City, Manhattan, so we actually have many, many pediatric dentists. We're very fortunate, but in many parts of the country or other places, they may not have pediatric dentists, and that's okay. There are many dentists that take care of kids, so just make sure when you call that you make sure that your dentist is comfortable taking care of young children. And in addition, many pediatricians care for children as well and care for their teeth So for example, I do think it's really important to go right away to the dentist. They'll count the teeth, they'll look for cavities that you may not be able to see. In certain times they may need x-rays, not always, and they can do a really good cleaning. It gets your child used to going to the dentist. And also, many times now, they can do a fluoride treatment where they protect the teeth with, so like a paint, they paint it on, and it protects the teeth to help prevent cavities in those first primary teeth as well. And some pediatricians actually do this as well too. So if you can't find or you don't have a pediatric dentist, make sure, especially that 1-year visit, that your pediatrician takes a good exam in the mouth, and if they have any concerns, that they refer you out to a dentist that is comfortable with young children as well too. So let me just give you a little bit of a recap again about tooth care, and then we'll move on to teething, because I know parents have a lot of questions about teething. I've gotten quite a few this week, so I want to answer them for anyone who's listening or who wrote into me. But to recap, so you want to aim to use a fluoride toothpaste right from the start, and you may have to try different flavors and different brands until you find one that your child likes. You want to aim for brushing twice a day. And even if they don't like it, they'll get used to it. So if you even have to wrap around and hold them and brush their teeth, the more you do it, the more often you do it, the quicker they'll get used to it, adding it into their morning and nighttime routine. I think you want to make sure that, as we know, as I said, sugar is a big culprit for dental cavities. So I think it's important to make sure that you really hold off on juice, and that if you're going to give your child, I would wait till after they're 1. If you feel the need that you want to give your child juice, just give it to them once a day, no more than 3 to 4 ounces. And after that, make sure that you brush their teeth. Often people tell me that they dilute it, and I think it's okay. You can dilute it that one time, but just diluting juice, walking around drinking with a bottle all day long, it still bathes with a little bit of sugar, not good for their teeth. Prefer sippy cup, and really, as soon as they can, start teaching them to drink out of a regular cup, whether it's water or milk. But the sooner they're sitting nicely eating their meals, sippy cups are really an invention for parents, right, to make it easier for on the go. But really, you want to enjoy mealtime, and so whenever you can, have your child sit down, use an open cup and a straw whenever possible. That will definitely help with maintaining their teeth health as well too. When they're sleeping or napping, you want to make sure that you don't leave a bottle in the crib. Don't prop up the bottle on the side, because again, that can cause more cavities because of the sugar in the formula, as well as juice. So any time that you're giving your child something, if they wake up and you feel the need to give them something to drink at night, leave only water in the crib. And as I said, you want to limit throughout the day all those foods that are sugary or sources that can stick to their teeth. So things like raisins and craisins and cranberries. You have to be really careful. Fruit roll-ups. Now there's all these gummy vitamins, and you're trying to be healthy and give them vitamins and probiotics, but these gummy chewy things are not good. Dentists hate them. They stick to the teeth, and then they're just a breeding ground all day long for those bacteria to eat on and to turn those sugars into acids. So you want to really be careful with that. But also, there's a lot of hidden sugars that you may not know about. Yogurts now that are labeled for kids are usually very high in sugar. Things like low-fat peanut butter, right? So you're giving peanut butter, but now the low-fat ones, usually what they do then is add extra sugar. So you want to be careful about that as well too. Things like that aren't sweet, like crackers and pretzels and cookies, often have a lot of hidden sugars as well too. So those processed foods, as well as condiments also. Like ketchup and salad dressings can have a lot of sugar. So really what I'm saying is, whenever possible when your child is young, if you can just quickly clean their teeth. Definitely a great time to do this if they can do it after breakfast, before they go to school. And again, at night after dinner would be a great time also to make sure that they're brushing their teeth. Again, learn to use an open cup as soon as possible, and encourage your kids to do that. You want to also check on the fluoride levels. Your child may need a fluoride supplement, and it comes in liquid drops. It also comes in chewables, depending on the fluoride levels in your water. You really want to have the balance, so make sure that you speak with your pediatrician or your pediatric dentist. You can inquire about fluoride varnishes, But do make sure that right from the start, even on the baby teeth, you just use a very small grain of rice size amount of fluoride toothbrush. This can be really helpful in building those strong teeth of your baby to keep them strong, because as I said, they are the placeholders until those adult teeth do come in. Oh, and something else that I think is important is many kids use pacifiers, and one of those quick tricks parents often do is if they drop on the floor, they lick it. So that's, to me, a big no-no. There's just so many germs, but also you're actually introducing those adult bacteria from your mouth into your baby's mouth that, again, are those bacteria that love to break down those sugars. So wash off the pacifier, need be under running water, but don't lick it and stick it back in your child's mouth. That's sort of a big no-no. So let's talk a little bit about teething before What's Up Wednesday ends. So as I said at the beginning of this topic today, teething usually occurs somewhere between 4 to 6 months, but usually closer to 6 months. Babies are first gnawing on things, they're putting their fingers to their mouth, they're drooling a lot, and that's just normal development. That doesn't mean they're teething yet. I actually just saw a patient recently who came in for their 4-month-old checkup, and they swore that the baby had teeth already. They told their whole family, and their family was so excited, they wanted to send pictures. And I examined the baby and I said, there's no teeth yet. And they said, well, how's that possible? They're drooling, he's putting his hands in his mouth, he just wants to push on it with his thumb. And I said, that's just all normal development, but I promise you there will be teeth, but it just wasn't the time yet. So be patient, your baby will get teeth, and they actually can start solids even before that they have teeth. It's definitely okay. Teething is what we call a diagnosis of exclusion. I don't really like to blame everything on teething, so things like high fever, that's not teething, vomiting, diarrhea, real illness, crankiness, and runny nose. Oftentimes they're sick, they have a cold as well too. Can you get a little bit of loose stool? Yes. You can have maybe a low-grade temperature, but being really sick, it's important to look for other sources. They may have an ear infection, they could have a stomach bug. If they have super high temperature, they're 102, they have a rash, it's often really not from teething. So make sure that you don't sort of just blame it on teething. If your child isn't getting better, they may not be eating as well. If they're not drinking or eating, again, and you're worried about dehydration, speak with your pediatrician, be seen by your pediatrician. They maybe have Coxsackie, they may have a sore throat. It's important to check. I don't like to say teething, I like to rule out everything else first. Before you call it teething, because first of all, your child's going to be teething for a very long time. As I said, they don't get most of their teeth in until they're almost 3, so that's a lot of teething going on. So you don't want to just be treating them every night with Tylenol saying it's teething unless you really know for sure. So what can you do to help with teething? So you want to obviously start off with the mildest things first, right? So they like to rub things in their mouth, so plastic teething toys or rubber teething toys can be very helpful. You can chill them. We don't like to freeze them because that can be really hard on their gums, but you can chill them, put them in the refrigerator. There's our little toys that may even vibrate, that have like little bristles on them, that you can even stick your finger in your child's mouth. Sometimes that helps. One thing that I like to do also is you can take like a wet washcloth, just wet the corner of it, put it in the freezer, and it doesn't have to be frozen all the way, but it gets cold and it's wet and they can gnaw on it and it melts and it feels really good on their gums as well too. So those are like great things to do, but the teething toys really can be very helpful for them to chew on, especially when they're teething. It's sort of like a puppy when they like to chew on things. There's those fruit nets where you can put in cold foods and they can just sort of lick and bite and chew on them, and that also can be very soothing and refreshing as well. Some people, and this I'm just giving caution, you have to be careful, have your child sitting, but things like people say a frozen bagel or a big carrot, not those baby carrots because that's a choking hazard, but a big fat long carrot where you're holding it and they have it in their mouth, that's cold, that may be helpful too. But again, you never want to leave anything because they can bite off food and that could be a choking hazard, so just be really careful. They could be sitting on your lap with you and holding it, and that can be very helpful. Distraction works wonders too, so reading or playing can really be helpful as well too. Music, anything that distracts them away from just thinking about their mouth can be helpful too. As I said, plenty of fluids can be helpful too. And if it is severe, speak to your pediatrician. There are pain medicines, acetaminophen, which is Tylenol, and ibuprofen, Motrin, Advil, generics as well too. That can be really helpful. if the pain is really bad. But again, you don't want to get in the habit of using it every single night or every few hours, because you just don't want to keep giving it if it's not necessary, because they can have side effects as well too. Same as things with over-the-counter, and I'm going to just caution, over-the-counter medicines and homeopathy, just because they're out there and you can find them doesn't necessarily mean they're safe, doesn't necessarily mean that they're helpful either. So for example, there's over-the-counter medicines that have benzocaine in them, Oragel, or other brands as well too. I never recommend them for many reasons, but one, it makes the mouth really numb, and sometimes you think you found one spot, but then it gets on their tooth and they lick it, and their throat can be numb. They can have then difficulty swallowing, and they just get cranky because it doesn't even feel well. They don't even like the taste of it. But you also have to be very careful with these benzocaine. The FDA actually really cautions against using them, as do I as a pediatrician, and the American Academy of Pediatrics as well too. It's not recommended. There's something called methemoglobin, but basically it can lower the oxygen level in your child's blood, which can be really dangerous. So it's just not worth it. All the other tips and tricks that I spoke about are much better to use. And also, again, just a caution on homeopathy. There's all these different drops out there they promise many things, although they say they're not for health purposes, or they're not scientifically proven, but many can be dangerous too. There were homeopathy drops out there that had belladonna in them, and belladonna is actually a hallucinogenic. And look, you have your baby, you don't want to do anything to harm your baby, and I know you want them to feel better, but really, is it worth it? They have been shown to cause seizures, to cause crankiness, irritability, difficulty breathing. So it's really not worth it to try things that we don't really know, and there is no regulations on them, so we don't often know the concentration, even if it's a small amount. You just want your baby to be safe. And on that note, 2 more notes actually on safety on babies that are teething. So long ago, wives' tales is to give some alcohol, dip it in some alcohol and put it in your baby's mouth. Grandparents did that. Again, I don't recommend doing that, because alcohol still can be absorbed, and your baby is very small, and they can get alcohol and intoxication, or even just poisoning from it. So please, no alcohol or nightcaps for your baby to help with teething. Just a real big no-no from a pediatric standpoint. And lastly, I just want to bring up something about those amber necklaces. You may see those amber teething necklaces that are out there, and there's an abundance from the evidence that there is actually no evidence. There's many claims out there in the retail department about what they do, and that these amber necklaces, you put them on the child, and that the heat from the body, it helps with inflammation and the inflammatory response, and helps with teething, and really has never been scientifically proven at all. And so I want people to really understand that, and you always hear these anecdotal stories. Oh, well, my child wore this necklace and they never had any teething problems. Well, I have a lot of patients who tell me, their kids were fine, they never had teething problems. And then there's other ones that always seemed to be crying and upset because their teeth were coming in and they were swollen. So each child is different, but I just want to warn parents against, one, the expense of buying these amber teething necklaces, but 2, they can cause strangulation, suffocation, and they can be a choking hazard. So you have to be careful almost with any jewelry, but these necklaces, right, they have little beads on them, so you never know when they can pull on them, they can break, they can swallow them. So I actually really do not recommend them to my patients at all. That's my caution to you. But if you do decide you want to use them, that you feel that is something that you want to do as a parent, then you should know the information that I'm giving you, but make sure that you don't put them on when they're sleeping, when they're not being observed or watched. If you want, just like any other jewelry, it's better to put it on their wrist or their ankle, but not around their neck, because of the risks, again, of them breaking and choking. I don't recommend them, but I just wanted to give you all that information. So I hope that helped. All kids go through teething, and I know how hard it can be. So I hope some of these tips and tricks help. And yes, sometimes I totally understand, as a mom having 3 kids myself, sometimes the pain reliever is all that works. And if that's the case, you can use that. It's okay. Just don't want to get in the habit of using it over and over. So this is Dr. Jen. I hope these tips helps you for caring for your kids' teeth, as well as these tips and advice on teething. And if you want more information about caring for your child from newborn through age 2, check out Pediatrician in Your Pocket, my new video series, a whole manual guide for new parents about caring for your baby. Just hop on over to drjen.com and you can find out more about purchasing Pediatrician in Your Pocket. You'll have all the information you need about caring for your baby, all those questions that you have, or you may not even know that you had, simply at your fingertips, on your phone, on your computer. Whenever you need it, I'll be there for you. It's Dr. Jen with What's Up Wednesday, and I look forward to any more questions or comments you have. Please leave them below or on my website, or you can also get me on Instagram at AskDrJen or on Twitter at AskDrJen. And I'll see you again next week. Have a great week.